Hello, everyone. Welcome back to St. Louis Teens, and welcome to the COVID-19 Innovators series, which features individuals and organizations working to find new and innovative solutions to fight this current pandemic. Today, we have Karina Popovich, who is the founder of Makers for COVID-19. Karina's innovative solution of making 3D printed life saving gear is protecting thousands of healthcare workers fighting for us on the front lines. Karina is a student at the Cornell University and recipient of several awards such as Amazon's Future Engineer Scholarship and the KPMG Future Leaders Award. So, Karina, we want to thank you so much and Makers for COVID-19 for providing life saving gear to thousands of healthcare providers around the country.
Thank you so much for having me. I'm super happy to be here and to tell you more about the work that we're doing and answer any questions you have along the way.
Karina, so our first question is, can you tell us a little bit about yourself and how did you get involved with 3D printing?
Yeah, that's always a fun question for me. I started 3D printing when I was in high school, and I happened to go to a technical high school. It was actually called Brooklyn Technical High School, and every freshman was mandated to take a class in 3D modeling. And since then, I really fell in love with the class and just having the ability to really design anything and then see it, be created and be made out of nothing, which is exactly what a 3D printer could do, which is super fascinating to me and almost felt like a superpower. And I think since then, I really fell in love with the ability to 3D print and anything really makerspace related, which is, laser cutting, milling, prototyping, and anything in between. And to me, that just became my second love and my first love, really. And that's how I really began in 3D printing.
And how did you sort of get your interest to the point where you had now started Makers of COVID-19? So, what sort
Yeah.
of inspired you to get into this?
Yeah. So I've been pursuing STEM for a long time. I mean, I'm currently a freshman in college and I started 3D printing very early in my first year of high school, all thanks to my school and thanks to my wonderful teacher, Miss O'Neill, who really pushed me to continue my engineering education. And thanks to her, I participated in several clubs and then went on to do Girls Who Code and a few other programs. And then that kind of really segued for me, really started off my career and led me to move into what I actually really loved, which was 3D printing. And I did a lot of research at NYU and lots of really fun teaching and learning at NYU's Makerspace as well. And it was just such an amazing experience being able to be in that space every single day for me that I constantly just felt excited and reinvigorated to continue building and continue doing more. And I think I've always kind of been had this fueled energy and fire for 3D printing, and it just kept growing over the years until I got to college, and I finally got myself my own 3D printer and started a 3D printed clothing line. And, very quickly, COVID-19 came around and I couldn't really be doing what I love to do, which was travel and share my love for 3D printing and build up my 3D printed clothing brand. So I decided to shift gears and I realized that 3D printing is absolutely necessary and capable of providing PPE to healthcare workers that can't otherwise get it or have access to it given our current situation.
So, what are the different types of PPE? I know you talked about that you make, and how many have you made and donated so far?
Yeah. Yeah. We have makers, we have over 300 makers, and they're making tons of different types of PPE. We mostly focus on face shields and face shields and ear savers, which are these little clips that you can put on the back of those masks. And typically, what those are for is to really relieve the pressure off the ears. Because I remember hearing one of the nurses that we worked with say early on that she had bloody ears because of the masks from wearing them all day long. And, being a nurse, they usually have to stack layers and layers of these masks on top of each other. So, thanks to our ear savers, her bloody sores were able to go away. And I'm sure that's been the case for many other nurses and medical workers around the country. So we've been doing ear savers, face shields, and we also have a few makers that do versions of the N95 mask and ventilator valves. And those are just some of the things that we 3D print on a large scale. We also have a group of makers that aren't necessarily 3D printists, but they are people who sew masks and donate fabric masks. So we kind of have a great group of people coming from everywhere and printing all sorts of different things.
And yeah, I think it's definitely incredible, not just when you're able to provide equipment that's life saving, but also, stress relieving and pain relieving as well. And
Yeah.
I did want to ask, are, these masks and the PPEs, is this currently only for New York, or have you been able to donate them to other states as well?
Yeah, great question. So, also to answer your previous question, I completely didn't realize that I forgot to mention how many we've donated. But to put it blankly, we've donated in the tens of thousands range. It's hard to put a number on things just because when you have so many people under one umbrella trying to do different things, it's hard to kind of keep track of who's doing what. But on a weekly basis, we're donating at least 3,000 shields. So we're constantly donating and making sure that we can support our community. And like you said, we aren't just in New York. We are all over the United States. We've served the Navajo Nation, Chicago, California, and so many other areas out there that have needed our help. And we've also grown to be outside of our borders, and now we're focusing on helping countries like Ghana and Mexico, and now even India, to make sure that they have the PPE they need and their medical workers need.
And if a hospital or a healthcare provider is in need of such PPEs to sort of help their workers, would they be able to call you to receive such equipment?
Oh, yeah, of course. We have all the information up on our website. Any doctor, nurse, physician. And again, I think it's very important to make this super clear because anyone can ask for PPE. It doesn't have to be a manager, it could be just a regular nurse who needs PPE for herself and for her friends or for her team. We really want to make sure that we can donate to anyone who asks for help. So if anybody fills out our form on our website, we will have an organizer reach out to them within 24 hours to confirm their request, and it's going to be in our queue, and a maker will pick up that request and start working on it within a day or two of it being put into our queue. So we've worked really hard to really make sure we have a system that can respond quickly and can donate quickly.
And I wanted to go back to something you said, talking about when there's so many different people working under one umbrella, it can get a bit difficult to, keep track of the specific numbers, and especially when things are, moving so quickly. How are you able to manage this incredible project with, such a large number of people while still being in college?
Yeah, I think that's a really, really hard one to answer. I mean, at the end of the day, I have to say I don't. It's hard to really manage both, and when it comes to doing something like Makers for COVID-19, which I've become super passionate about and really just involved. It's something that I feel takes priority over schoolwork, and for me, I in many cases I feel like my extracurriculars are the places where I can learn skills that I could never learn in the classroom. So for me, I kind of prioritize Makers for COVID above my schoolwork, and that has been able to work specifically for me. And not to say that I don't care about schoolwork, because I still do. I come from an immigrant family, so grades are everything. And this is something that I've been able to kind of try to manage. But again, I have to say it's very difficult to really do both and lead a double life, you can say. And the biggest part that's been helping me is really just having organizers and having friends that have helped me and have kind of been able to support me when things get really hard, or I have a particularly rough week, so I can hand some of the work off to my friends or organizers that are there. So that's been really helpful. in trying to manage things. But I think at the end of the day, it's just taking it day by day, and again, also realizing that, as much as I want to really be in control and manage everything perfectly, I can't do that. And I'm sure no good manager can either. It's just not something that's feasible. And I think that's something that I've come to learn and realize, and it's helped me through a lot.
And I think that throughout these past few months, for the most part, I think as a nation, we have become successful in social distancing. So, it seems that we may have successfully been able to flatten the curve. So, from your perspective, have you been seeing a trend for a decrease in the need for PPE currently, or has there been no such trend?
Yeah, so I'm based in New York, and in New York, we've definitely seen a huge decrease in need for PPE, which is fantastic, and we're super eager about that. And us being better at social distancing, but we also realize that as things get better in New York, there are other places such as the Navajo Nation that are really suffering because they did not get the proper care that they needed this whole time. And what we're doing now is really shifting gears to focus on those areas and focus on the areas that haven't been taken care of, or still have that high risk, or still have that high and rising count of COVID-19 cases. And we've been working specifically within our team, to find nursing homes in these facilities within these areas, these hot areas, and find the facilities that may not know about us, and reach out to them first, so that they can be aware of our resources and benefit from them. And I think that program has been really beneficial to us and our mission of helping anyone who's in need and really supplying the PPE needs out there. But I feel like now, with all the recent events that are going on, and due to protesting, which is all for good reason, and for good intent, I do believe that we will see a spike in COVID-19 cases fairly soon. So I think that's something that me and my team and all the makers have been really kind of anticipating and preparing for. And given these past few months that we faced and gotten to build up as a team, I believe that we're more than ready to handle it.
So, I personally volunteer at some of the shelters for the unhoused here in St. Louis, and we were able to start a project where people in some of the shelters are sewing cloth masks for themselves, and others, in the same shelters are facing homelessness. So, do any of the products of makers of COVID-19 help the unhoused population in avoiding transmission of the disease, particularly when social distancing isn't exactly the most feasible in those situations?
Yeah. Unfortunately, that's something that we haven't really gotten the chance to really work on yet. And it's one of those things that I've wanted to work on and have really had on my agenda as one of the things that we need to help out with and really be concerned about, because that is a serious concern of mine personally and of a lot of our organizers. And I think, being overwhelmed with all the things that we haven't gotten the chance to get to it. But with things finally slowing down for a little bit, this is definitely an issue that we need to come back to. And I would love to talk to you more about how we can work together on this more, because we're constantly on the lookout for ways to help out, especially people that are truly in need of PPE.
And Karina, I finally did want to ask you, what is your advice for teens and other innovators during this time and during this crisis?
I think my best piece of advice is definitely take advantage of opportunities out there for you. I think that one of the things that really kind of worked out for me is, and this is kind of throughout my high school development and into now, I've constantly taken advantage of every single opportunity there was out there for me. I was that kid that applied to 20 applications to scholarships and whatever every single few weeks. And I think it's one of those things that the more you put yourself out there, the more you're likely to fail and the more you're likely to also win. So I think it's very important for people to really take advantage of every opportunity out there. I think that COVID-19 is a very difficult time, but the future after COVID-19 presents a bunch of opportunities. And it is now that we as a community and as teens can really work together to build up that future and build the solutions for that future. And now is the perfect time for it. No school, a lot of internships are canceled, and there's a lot of free time. And to add a little more onto that, this is just a personal note that I believe in. Failure is truly key. You really have to fail to understand and to learn and grow. But it's not just a failure that's important. It's also important to reflect on it and to realize what you did wrong and realize what you didn't. And I think, failure aside, if people and teens were to be more self-aware and to constantly think about their actions and what they did and what they can do to improve, they would have ample chances. They would increase their success by so much more. And that's something that I've personally realized for myself. So I definitely give that piece of advice to everyone out there who's listening.
And as we continue to hear how doctors and nurses are falling sick to COVID-19, Karina, your innovation is truly life saving, and we cannot thank you enough for the great work that you are doing in saving the lives of our healthcare providers and your service to our country. The link to Makers of COVID-19 will be provided in the description below, so if you want to be a part of this life saving movement, spread the word, please sign up or donate. The link will, again, be in the description. And finally, thank you so much, Karina, for your time today and answering all of our questions.
Thank you so much for having me. I am happy to be here. Please support Makers for COVID-19. Stay in touch with me over social media. I'm on Instagram, Facebook, Twitter. You can find me, Karina at Karina.Popovich, Karina Popovich. Either way, you can definitely find me, reach out, connect with me. I love supporting youth and STEMnists and technologists and entrepreneurs. So please go in and give me a follow, and I'd love to get connected.